the push to get more children vaccinated. Today, doctors discussed how misinformation or lack of information has caused many parents to be skeptical about getting their children vaccinated against COVID. Channel 8's Ariana Martinez joins us from Children's Hospital in Omaha to tell us about a new way parents can get their questions answered.
Max the Vax is a statewide partnership between the Nebraska Department of Education and physicians from throughout the state to bring parents credible information regarding the COVID-19 vaccine and their children.
Our real push right now is to make sure that folks understand the value of the vaccine, and whether or not there's a mandate that comes later, I think that will be kind of done in the right process to make sure that would be appropriate.
The reason for the partnership between medical professionals and the Nebraska Department of Education is to keep kids in school.
We know that when students even miss just as few as 4 days of school, we've done research on that, that's had an academic impact on students. 4 days.
This website has answers to questions as well as free clinic information across the state.
Provides us an opportunity to take the best of the information in one area of the state and ensure that it's transmitted to another.
Over the last 21 months, we have seen changes to how the coronavirus impacts us all.
The data out of China initially did not include very many pediatric cases, and so the thought was COVID was not going to impact kids, and we're a pretty young population in the U.S. And then Delta came and really showed us that kids get COVID just like adults.
Even though Children's Hospital is located in Omaha, they serve children throughout the state and beyond. Doctors say since May, they have treated 80 patients with COVID complications like MIS-C.
If you look at the children who have been vaccinated, we, to my knowledge, have only had one child who was observed for heart inflammation, which rapidly resolved and was essentially only treated with ibuprofen or a similar medication, as opposed to our MIS-C patients who many of whom required ICU, many of whom required blood pressure support, many of whom required a ventilator, and we had a child who required ECMO, which is like heart-lung bypass. So much more significant disease, and that's separate from our COVID patients who have been in the ICU and on the floors.
Right now, information can be found on maxthevaxne.org in various languages. And there is plans to expand the website so parents can ask questions directly online. Reporting from Children's Hospital in Omaha, Ariana Martinez, Channel 8 News.